Hi guys. So what I wanted to talk to you about was what to know when you're not getting CBT. And I think CBT is one of the most common types of therapy potentially. It's one of the nice guidelines that are recommended for a whole range of mental health difficulties, but unfortunately people sign up for CBT but they're not actually getting CBT. So I wanted to give you the 5 ways that you can realise if you're getting CBT or if you're not getting CBT. So really, first of all, is that CBT isn't a mysterious type of treatment. When you have CBT, you should know what you're doing and what you're not doing. And in saying that you'll know the model, you'll know where you're going to be going in the process of therapy. It really shouldn't be a secret. Even from the beginning, from the assessment, your CBT therapist will outline what the difficulties are, and obviously you'll have a lot of say in what you'll be working within. But when you do that, you will then know what type of model you will be using. So it won't be that you'll just be working through aimlessly. You'll know if it's anxiety, that you may be looking at generalized anxiety, and if you are, there's a model called the Dugar model which you might be using, or there are loads of other different types of models. So if you are having CBT, the first thing to really ask, and you should know, is what model are we following and how are we going to follow that. So that headline is, it shouldn't be mysterious. You really should know what you're doing. And if your therapist hasn't told you, ask, because they will be able to explain what they are doing and why they're doing it. And that's what I mean when I'm saying the models, that all the models have been developed in line to help people with specific problems. So they're the ones that have the evidence base. They're the ones that have got all the research behind it, and that research has been tried and tested on loads of people that show that those techniques and those methods are most suitable for the person who presents with whatever type of difficulty, whether that's anxiety, OCD, depression. There will be a real clear guidance. And within that, CBT has goals. If you don't have goals and you're not doing CBT, and I've said this quite a few times, but you will have a goal in mind. You'll agree it with your therapist at the beginning. And when you do the goals, they are often going to be called SMART goals. So SMART goals stand for specific, measurable, achievable, realistic, and time-bound. And if you're not having goals, then you're not doing CBT. So again, in the beginning, in the assessment, you would set your goals with your CBT therapist. And when you set those goals, that will then align with what I was just saying about the models and it shouldn't be mysterious. So you'll set your goals. So whether that is that you want to be able to go to more social occasions, then the goal will then be made SMART. So made that specific, measurable, achievable, realistic, and time-bound. So if you want to go to more social occasions without feeling anxious, how are you going to get there with your SMART goals? So that is something really to bear in mind. So that's the second thing. The third thing is that you're not learning any skills. If you're not learning any skills at all, then you're not doing CBT. CBT is really, really practical, and although that you will talk about things that have happened in your past, that will form part of the assessment and also the formulation. As the main part of CBT, you will be learning skills. So again, if you're not learning any skills, then it's not CBT. It's not like some other types of therapy where you would go in and discuss things and go away and then come back. You'll have different skills that you'll practice within session. So it's not that you're just going to be told to do things and that your therapist will expect you to know exactly what to do. You'll practice those skills within session. And then I suppose linking into the fourth thing to realise if you're not doing CBT is that you haven't got any homework. So you will learn the skills and practice those skills in session, and then you will practice and do it for homework. So within that idea that some people don't like the term homework, which is completely fine, that all of us have different experiences when we're going through school or education where we are set homework. So sometimes it might be, we might agree to call it like work between sessions or tasks to practice. And again, it's not meant to be mysterious. That will be that agreement with your therapist of what are we going to call this? And then you practice those skills. So the skills could be about challenging your negative thoughts. So the therapist, the CBT therapist, will teach you real structured ways of how to challenge your negative thoughts. You have that skill and then you practice it between the session. And then another way or another skill that you may use is when you're looking at worry. That often when we worry about things, it's really difficult to know if the worries are hypothetical or if they are current. So within that, what you would do in the session to practice the skills is to identify, is this worry current or is this worry hypothetical? And a super easy way to be able to challenge your worries and to really work out what you are doing is to ask yourself, can I do anything about this now? If the answer is yes, then it's something current, you can do something about it. If it is no, then it's a hypothetical worry. Such as if you're thinking and you're sitting there and you kind of bring it to session, oh, I keep worrying about if I'm going to get any work done on time. That it may feel that that's a current worry because it's about the work, but it's really hypothetical because you don't know if you're going to get the work done or not. So that's the kind of an idea of the skills that you would practice in session. So you'd bring the skills to your CBT therapist, not your skills, your worries. And within the session, you would learn how you can distinguish between the worries. Then for the homework, you would do something called a worry diary. And within that would be when you would look at charting your worries and then distinguish if it is current or hypothetical. So I've just got a question and I'll go back to something else. So how did you adopt your own orientation of therapy? So what I'm talking about now is just CBT. So really why I wanted to talk about it is I have a lot of people that come to therapy that have said they're doing CBT, but really when you talk about it, you realise that it hasn't been CBT, and that can be difficult because it can make people feel that they're not progressing or they're not getting better or they're not being able to overcome their difficulties. So I just wanted to really outline those areas. But for me, thinking about your own style of therapy, it depends what you are trained in. A therapist will generally only work within the models or the kind of the types of therapy that they're trained in. So whether that's CBT, so cognitive behavioural therapy, whether that's CAT, so cognitive analytical therapy, whether it's DBT, which is dialectical behavioural therapy. There are so many different types of therapy. So often you may find a therapist or a psychologist who has done trainings in different types of therapy, and then they'll bring it in to kind of create their own type of therapy. So, and for myself, that I've done various other trainings. I've done training in schema therapy, in mindfulness-based therapy, in dialectical behavioural therapy. So when I'm in session, I will bring that in. But again, if I'm just doing pure CBT, then that's what I'll be looking at. So yeah, hopefully that answered your question. If anyone else has got any questions about CBT, then feel free to drop it in the chat. But thinking about just looking at CBT, one of the things that we often do in CBT, it's active. So if you're just coming into sessions and just sitting down and kind of then leaving, it is a real active therapy. And a lot of the times with my clients, I take the sessions outside of the therapy room. So often some of the things that we're looking at is exposure. So exposing people to situations that they're either fearful of or that make them really, really anxious. And that could be going to a supermarket. It could be going to go and get their bloods done. I've been with someone before to go and get their bloods done. I got my blood done first to kind of show, and it's about you being able to demonstrate those skills that I mentioned, that you can actually put them into practice. So it's about kind of, as I said, being really active. If you're looking at some of the models for panic disorder, within the sessions, you really try and emulate the feelings of panic so you can learn the skills to be able to reduce your panic and to be able to manage your panic in session. So that's what I mean by saying that if you're never leaving your chair, then it's not CBT. It's just the idea that the therapy is active. It involves you being involved as much as the therapist really getting you involved in the skills as well. So they're the kind of main areas to look out for when you are going for CBT, to kind of check that you are getting CBT. And I've spoken about this before, but it is really important to make sure that the person that you're working with has the right qualifications, has the right accreditation, because it's still not, I think, as widely known that you do need certain things to be able to practice. And again, in the UK, some of the titles of therapists aren't protected. So what that means is that anyone can use it. Someone could do a 1-day course in CBT, and they could say that they're a CBT therapist because the actual title isn't protected, which for me can make it really, really scary and really overwhelming when you're looking for therapy. So yeah, hopefully that has explained a bit about CBT to help you to understand when you are and when you're not getting CBT. So as I said, if anyone's got any questions, I'll leave the kind of space just for a little bit if anyone wants to think about any reflections. If you've had CBT, what do you think about it? Or any questions about the therapy process in general. If not, I'll kind of talk a bit about some of the other skills that are helpful to learn in CBT. And just I suppose on the line of that is that CBT is a time-limited therapy. So by that, what I mean, it's something that you're not going to do for years and years on end, and in line with the idea that you'll know exactly what model you will be using. You'll know how many sessions that you should be having, or roughly in a kind of, there'll be an estimate, whether it's kind of between like 8 and 12 or 12 to 16, something like that. So it will be clear. And there are other types of therapy where you can do it for years, but CBT again isn't like that. So it's about knowing that, but because you are learning the skills, you are practicing the skills with homework or the kind of the activities between the sessions, and you don't actually need to be going for a prolonged period. But I think one of the main things is when you are trying to find a therapist is to ask a range of questions, prepare your questions and go to the sessions with a list of questions. I don't really care how many questions a client comes with. I think as long as you've got those questions or you've had those thoughts, and even between sessions, if things come up, there is that space within CBT to discuss it. And within that, I think it's really important to say that CBT is quite structured and it's not suitable for everyone. You have agendas that you go through, you talk about the homework, you practice the skills, but sometimes people need just a space just to reflect and to relax. And sometimes that it may be about thinking about what type of model of therapy is right for you. And it may not be CBT, and that's completely fine, but it's just thinking about what your needs are. And can this therapist help me with what I need? And not every therapist is going to be right for every person, and not every person is going to be able to work within kind of what that therapist can offer. So when you're trying to find your right therapist, speak to a lot of different therapists. A lot of them will offer like free consultations. So take them up on that. Really get to know the therapist within that consultation. Find out if you click. Find out kind of what they offer, what they don't offer, and seeing if that really meets with what your needs. And I'll say this time and time again, but one of the most important things is that you get on with your therapist. And I think that's kind of something that you really need to consider. You're going to be telling this person a lot of things, probably stuff that you don't tell hardly anyone else, if anyone at all. So kind of really making sure that you feel comfortable, you feel supported by that therapist. So I have a question. When practicing CBT, is it important to explore your client's background? Yeah, definitely. And I think that's kind of a misconception of CBT, because it is so focused in the kind of the present and you're doing really active things, you're practicing the skills, that we don't care about what happened before. And that's not true. That will form part of the assessment, and that will form part of the formulation. So the formulation is like the map of all of you together, and that background will come up as part of that, because if you don't know, I suppose, all of your client's background, then it can make it really difficult to be able to help them in the moment. So yeah, you definitely want to explore it. It may not be the focus of it, but it would be definitely something that you explore. If I'll give you an example of, I suppose, that when it would be the focus of it, if you're doing like trauma work, the trauma events are definitely going to be, you're going to need to know them to be able to work on them. And even if you're looking at something which seems that it's really based in the present moment, such as maybe someone's anxiety in speaking up in class, that may seem, okay, that's a real limited, or that's a real like difficulty that is just focused in speaking up in certain environments. But if you don't know where that's come from, then how are you meant to be able to support them and to be able to work through with them? So yeah, hopefully that answered your question, that although we kind of do focus on what's going on, if we don't understand what's gone on in their background, then how are we going to be able to really help heal that person? So yeah, hopefully that answered that question. But thank you for that. And I hope that this is just kind of, again, what I keep saying about my lives is I just want to try and demystify therapy. I want to be able to try and support people to engage in therapy if they need to, but also just to understand about it. And I hope that that has helped in terms of CBT. Yeah, and that's the struggle. It is difficult to find a therapist, and sometimes it is about going through a few therapists. And as I mentioned, it may be about doing the consultation, so speaking to a range of therapists on their consultations, which a lot of them offer for free, to find the right one for you. And sometimes it's not an easy process, but when you find the right one, I hope that it will be the one that will be able to help you to get through your difficulties. There are loads of range of directories in the UK that you can use, as well as obviously going through the NHS and things like that. But please don't be afraid of speaking to a range of them and finding ones that suit you. Okay. Cool, guys. Well, thank you for joining me this afternoon, and I will I'll do another live next week or something like that. So look after yourself, and thank you everyone for engaging. Take care.